Patients often come into our office with questions about dental treatment decisions. Things like, should I get a root canal or just pull a tooth? Is an implant always better? Or can a filling fix any broken tooth? I'm Dr. Dustin Yoakum with Shady Spring Dental Care, and today we're breaking down some of the most common dental myths. If you need a root canal, should you just pull the tooth and get an implant? Not necessarily. There's multiple factors to consider whether to get a root canal or pull the tooth and get an implant. Medical conditions, amount of natural tooth structure, if the tooth is broken, or why the need for a root canal has become. Is replacing a tooth with an implant always better than saving your natural tooth? No, not necessarily. Your natural tooth would always be the ideal solution, but there are scenarios where that is not a viable option. Does a damaged tooth always have to be pulled? No, this brings in the options like a root canal or a crown or potentially an onlay or a simple filling when a damaged tooth presents in the clinic. Is a dental bridge just as good as a dental implant? A dental bridge is a good option to replace a missing tooth. It involves crowning the two adjacent teeth with a fake tooth in the middle. It is a fixed restoration, meaning that it does not come in or out of the mouth. A dental implant is also a fixed restoration. It involves an implant into the bone and then a screw that is placed on top of that implant after your bone is healed around it. Is professional whitening actually better than whitening you can buy at the store? Yes, in-office whitening provides a higher concentration of whitening solution that is not available to buy over the counter. Does an infected tooth always have to be extracted? Not necessarily. There are multiple other treatment options when an infected tooth presents, such as a root canal. If your tooth pain stops, is the problem gone? No. Many patients feel better after a round of antibiotics for an infected tooth. The pain will be alleviated. However, that problem still exists and needs a definitive treatment. Are dentures the only option if you lose several teeth? Not necessarily. There are many options to replace missing teeth, such as bridges, implants, and partial dentures. Can a filling fix any damaged tooth, or do you need a crown? This answer is case dependent. Some damaged teeth can be fixed with a simple restoration, such as a tooth collar filling. Other teeth do need full coverage restoration, such as a crown or an onlay. Do you really need a crown after a root canal? General answer, yes. Most posterior teeth are recommended to have a crown after a root canal to protect the remaining tooth structure from fracturing. Some anterior teeth, however, do not require a crown after a root canal.